Broadcasting from the business capital of the world, this is the Podcast Business News Network. Healthy Possibilities. That is right. Dr. Catherine Alinovi joining us here, and she's making that happen. She actually is running an holistic practice now, and that's what she's doing. And it's fantastic because she is helping so many pet owners from all over the world, not just in the Tampa Bay area where she's from or her Mexico place, everywhere she helps with
Everywhere.
any type of animal. She's here to answer your questions and to guide you through some of the things, that you could be doing to help your babies and medication free and alternatively. So welcome back. Healthypossibilities.com is the website, and we're honored to have you back. What's happening in your
Thank
world? I
you.
know you recently adopted another baby boy. Is it
Oh
a
my
boy?
goodness.
Is it a
We
boy?
did. We did. Yes, yes. Probably about a year old. Sort of looks like a Labrador, kinda. I don't know. He's got a big boxy face, makes him look like a little bit of a hound dog. But of course, he's intact male, so he has a big man face. And first couple of days went smooth, of course, and then he decides to see where he stands on the totem pole in the household. I'm like, that's fine. But the top dog is the top dog, and she will put your rear end down if you try to challenge her. So
Ah,
his sneaky maneuver yesterday was she loves to carry her Kong, and she put it down in the yard, and then he picked it up, and I had to have a talk with her. He was like, nope, that goes right back to Yuma. That is the queen. That is hers. You do not, because you are setting up a fight. So, this is one of the things I tell people. They get a new animal and they say, well, this and that, this and that. I'm like, takes 3 months. Be patient.
uh-huh.
It takes 3 months.
Yep.
So we've only had the little man a couple of weeks. He's starting to feel better. He's putting weight on. Um, Even though I've spent lots of time talking to people, the health benefits of keeping organs in pets, that's ideal world. I've got 9 dogs in that yard, and Yuma, the um, German Shepherd, she's ultimately going to be a breeding young lady, and
Oh,
so
wow.
she does not need to have mixed street dog puppies. So we're going to get the little man a little bit stronger, and we are going to take off his parts. Right. There's having puppies, and there's having puppies willy nilly. We don't want them willy
Got it.
nilly.
Got it.
Planned, just like you've had planned kitties, which that's my segue, because you were telling me before we started that the kittens are 3 weeks old now. So last week their eyes and ears were open. Of course
Yeah.
they're gonna walk around now. Their brain says, "Ooh, what's that? Ooh, what's that? Oh, go look at that." And they're standing up and they do this little head wobble, and it's so
It is
cute.
so cute. Yes, they're in the
It
upstairs
is.
bathroom. So I just had to shut the door because last night they started coming out and I'm like, can they fall down the steps? They can go right through the spindles and
Yes.
fall over. I'm like, okay, so I have to
Yes.
relocate them later downstairs and I'm going to go on Amazon, look at some type of like gate things or something to keep them, a little more, so they're not running around
Yeah.
everywhere. I can't do that yet, and then plus they're peeing and stuff. So that type of thing. Have not introduced them to any food yet. I've been wetting. Well, I put
Time.
what I have is the extra formula from the babies that didn't make it, and I've been mixing it.
Okay.
And so, Mama loves it because I have it. And I know it expires like
Of
in a
course
few
she
months.
does.
So I'm
Yeah.
giving it to the mom. I figure she can have it. And I tried giving it to the
Okay.
kittens, pushing their face in it to whatever. They lick a little, but they haven't gone near it yet. They or the water, but I
Right.
put it down
So
just to like so they get a sense, but nothing yet like that. And then
the
the goat
kittens
smoky totally.
don't understand that food comes from anywhere except from mommy's nipple yet.
Hmm.
So when you put it out, they're like, "Oh, what's that?" And it's the rest of them exploring the world. You just put a tiny little bit down in a flat dish, and they're going to wear it. They're not going to eat
So
it.
cute though, but it is cute they're wearing. Yeah, that's
It
like.
is cute. But then they groom themselves. Mommy grooms them, they groom
Mhm.
themselves, and they go, "Oh, what's this? My foot tastes like goat milk. Where did this
Yeah.
come from?" And then they start looking for food. So you're doing great. Just put it in a flat dish.
Okay.
Let
Okay.
them wear it. Mommy will clean them up. You've got the washcloth thing going on too. So between you
Mm-hmm.
and Mama, you guys are gonna clean them up. This is normal kitten development. It's
Yeah.
exciting.
Yeah, thank you so much. They're wonderful. So there's three of them. They're healthy. Now, Mama, this is where I have a problem with. Well, I noticed 2 weeks ago, we shoot about a week ago maybe, but didn't think anything of it. She's laying in the box with them and she just looks different. I'm like, why? What looks different? And my son 2 days ago was like, Mom, it's the lip. I'm like, oh yeah, her lip. Okay, it looks like she had a stroke. Like it's her left. It's droopy.
Swollen.
It's a little soldier. So now I'm like, okay, she's alive. She's fine. I'm not too worried. Now let me feel this area. Is it possible? Yeah, like that. I feel like a little, like the gums, like this comes down a little. I feel it does feel like there could be a little sister bump there. The gum is, but I don't know what that is.
An allergic reaction.
Oh,
It's an allergic reaction. It's something that cats get. So if the fancy word, when you look it up on the internet, the common name is rodent ulcer. I have no idea why it's called rodent ulcer. It's got nothing to do with rodents.
okay.
But you can find it easier that way. The fancy word is eosinophilic granuloma complex. Oh my gosh, what does that mean? It's in one of the white blood cells says I'm having an allergic reaction. It's almost
Interesting.
always a food reaction. And you know what? You just told me you were sharing formula with mommy. She's having an allergic reaction to the crap in the formula.
Wow. Okay. There you go. I got goosebumps. That's like, wow. That's definitely maybe what I 'cause I just started doing
Okay.
that. So I'm going to
Yeah.
stop that. But again, wow. Okay. And it is a little swollen in this area. So I'm like, is it a
Mm-hmm.
canker sore?
Mm-hmm.
Do they get canker
Mm-hmm.
sores like
It
us
looks
or
like
something?
it.
Yeah.
It looks like a fat lip. Yeah.
Yeah. Like kind of like,
And
mm-hmm.
it uh-huh. And see, Jill, this is what's beautiful. You and I have been talking for several weeks. I know what's going on, that sort of thing. This is what my monthly membership is about because I talk to people and I start to get a feel for what's going on in their family. And then you gave me timeline, not even realizing that you gave me timeline. I'm like, bing, 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 bing. That's what changed is you
Mm-hmm.
started giving the formula to mommy and she got a fat lip,
Yeah.
which tells you that that powdered formula is CRAP. Um,
I'm writing
just
that
throw it
down. I don't know
out.
what that is though. Oh, okay. Okay. I thought it was great stuff. Because vet
Uh,
told me to buy it to try to save the lives of the babies. Now I'm like, hold on. So now I'm giving these babies that are
okay,
already dead crappy stuff.
right. So understand, yes, thank you for the perfect body language, facial expression. When we come out of veterinary school, we do not have a lot of nutrition training. We have some fundamental nutrition training, but our big training, and that's what it actually is training, not education, is we get free lunch, free dinner sponsored by the pet food companies. We eat snacks, yummy food, because it's a horrible long day. It's 8 hours of pure torture. And you give me free pizza. I'm going to listen to your discussion on why your food is supposedly so great. Our analytical mind has shut off. We are no longer asking intelligent questions. We don't care because there's no test coming. We just go, oh, Company M, how nice. They provided me free pizza. They must have good prescription pet food. We never, ever, ever, ever once ask about quality of the ingredients. We are not educated. I graduated vet school thinking a long list of foods were good. They were not. There are legal allowable levels of mercury, cadmium, arsenic, and lead in cat food, dog food, and freaking puppy and kitten formula.
Wow. And this is
It's
what she's been
offensive.
teaching me. It is disgusting.
Right.
It is
It
disgusting.
is. And you
Uh,
want to trust your vet because your vet has loving intentions. But it's a question of how much has your vet had training on the quality of the ingredients. Your vet does not go to the AFCO meetings. AFCO,
Okay.
AAFCO. It's on the front of your bag of cat or dog food. It says
Yes,
complete and balanced according to AFCO standards.
saw that.
American Association of Feed, not food, feed
Okay.
control officials. These are all the state regulators who get together.
Yeah.
I am not lying. They say, well, we are upcycling human food waste into pet food and keeping it out of the landfill. We're doing good.
Wow.
Okay. Now you understand why I've been harping and nagging and harping and nagging at you until it's in your face. Oh my God, I was trying to do the best, and look what happened to my girl,
Princess. Yeah.
right?
Yeah. Okay.
It's
Well,
it's a rude slap upside the face. And it's I go to the AFCO meetings. That's where I'm going to be next week, which is
oh,
why I can't play on the
okay.
phone with you,
That's
because
okay.
I'm going to be sitting in a room with the FDA and the state regulators saying, "Oh, that waste product. I really don't think it has a place in pet food, but you're going to regulate it and allow it anyway." And
What do they
I
say to you?
represent.
What do they, what do they, and there's plenty more people like you there, I'm sure too, right? Or they
No,
try not to
not that
invite,
many.
or they try not to
There
invite
are
people like you. Like,
there
no, be,
are about a dozen of us. There are about a dozen of us who represent fresh pet food, and there's 500 people who represent waste product, and the whole giant financial industry. You do understand in the United States, we humans spend $36 billion a year to buy food made from waste.
oh my gosh.
Waste. It's
I'm writing
been
this down.
thrown out. It is illegal for human consumption. It is legal for dogs and cats.
Oh, what do they
30,
say at these meetings? What?
I just told you, we are keeping this waste out of the landfill and helping have a sustainable environment.
That is insane.
It's
That is
insane. It's
disgusting.
offensive.
Well,
Right. It
I,
is. It is. And it's not until you get slapped upside the head with something in your own life that you realize, oh my goodness, this woman's been just nattering, la 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 la. But oh my God, look what happened to my princess. I
here you
forgot
go.
princess. I
Yep,
remember Simba's
that's
name.
fine. Stop, stop. But wait, this gets even
Right.
better. So hold on. I'm at my sister's house now on Monday
Okay.
night for her daughter's, excuse me as I scroll through my phone, on the 13th for her
Yes.
daughter's 15th birthday. And she's got a dog. Okay, about a year
Mm-hmm.
and a half old, and I'm kind of scared of the dog. It's a mini, it's a mix, but it's not mini. I can't tell you what it is. I don't know what it is. It's a mix, but it's got these severe aggression issues, which she needs to work out, and she hasn't. Her
Ooh.
name's Ella. She's not fixed, but if she's near one person in the family, if you try going near her, she bites. She bit my dad's hand, like, and she loves my father, but she bit him up really bad last year. She did it to me when I tried touching my father when
Oh,
she was on the bed. So she's got this aggression thing, which is a whole nother conversation, which you'll be
right.
great to give me advice on that. But hold on. Now she's there and she's about to feed her dog. And again, I'm not used to dogs. I don't have a dog. So I'm looking at what she's feeding it. And I took a picture of it. Ready? I said, well, Jen, I
Okay.
bet you this isn't good. It's called Caesar Wholesome Bowls. Wait, hold, I can't. She's pointing to
Um,
it. And I'm like, Jen, I
right.
bet you it's bad. I said, I'm going to talk to Dr.
It
Cathy about
is. It is
it.
bad.
But no, it's showing
Um,
real meat. Look, that's real chicken. And she's like, yeah, oh, it's real
uh-huh.
chicken. She's pointing to it.
Uh-huh. The marketing is
Chick, it's not regular
intense.
grade. Like I don't think it's like grade A, like we eat, but it's a part of, it's like a different grade of meat. But it's real. She kept pointing, it's real meat. And I'm like,
Okay. So you're
Caesar's
right. Let's
Wholesome Bowls.
let's look at Bill the Bull. Bill the Bull is raised, he's fed in a feed lot. He's not pasture raised. So, which means that he eats a lot of corn that has been treated with more Roundup than is legal for you and me to eat. He also is eating so much heavy metals that he has toxic levels in his liver, so that if we or our pets eat that liver, we can get liver
Oh,
disease. So, Bill the Bull is aggressively fed. He gets big enough to go to slaughter. He
wow.
goes off to slaughter at a USDA facility, and the inspector looks at his carcass, and the inspector goes, "Well, that's illegal, that's illegal, that's unacceptable. All of those parts are trash for human consumption." They get thrown into a bin. Sometimes they get treated with lye so that it's just double assured it does not get back into people food. Then it goes to pet food. That is the so-called real curse word meat that your sister thinks is in that food she's feeding. So you're right. Your sister's got a couple of issues. She's accidentally feeding horrible food, and she needs a trainer
Yeah.
because your her dog is resource guarding, which it's like a little kid on base. I'm on base. You can't touch me. Nah, 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 nah. I get to
Yeah.
bite at you. Blah, blah. Because that's all dogs have is their teeth.
Yeah.
They don't have words. And that's lack of security because her dog doesn't know what to do. And that's why working with a trainer really actually trains us. we
Mm-hmm.
I am my biggest problem with my dogs. People come in here and I say, you should change that, you should change that. But then I go home and I do the same thing. So that's why I also have a trainer.
Yeah, yeah, yeah. It's so
Hmm.
sweet. I get it. I get. Wow. Yeah,
Yeah.
and she's bitten my niece. She's bitten everyone. But then last year she got my dad so bad where he, again, I'm no doctor, but I don't know if it's an artery or whatever. But the thing was like squirting out. Like, and he didn't go to the
Oh,
hospital. It was so he held pressure on it. He's old. He didn't want it, but it was bad. And she does it to the growl, and then she does it to anyone that goes near someone. In the it's so territorial. And then she's like, well, maybe because she's not fixed it, I should get her fixed. That'll change it. Okay, yeah. Mm.
she can get her fixed. It's not going to change the
Oh,
behavior.
they
The
gave her a pill.
sun,
The vet gave her a pill, like an
Prozac.
anxiety pill, or yes, the human
Prozac.
pill. Yeah, doesn't
Yeah,
help.
we give Prozac to dogs. And do you know
Doesn't
what
help.
some of the side effects are?
What?
In
Aggressiveness?
humans, depression. In animals, the aggression worsens. And then the science about getting animals fixed, there's a group of dogs who become more fear aggressive after getting fixed because nobody told them what the heck was about to happen. Drop me off, pass me off to somebody who doesn't care and drags me through this smelly room, sticks me. I wake up, I have a new zipper, I have pain. I will never allow that again. I'm going to become fearful, more fearful in any new situation. So
Wow.
I
Mm.
would highly suggest your sister work with a trainer so that she
Trainer.
can
Yep.
save this
Ah,
dog's life.
yeah.
Because if your dad had gone to the hospital, there would have been a bite report.
Oh,
And then your
God
sister would have
forbid.
gotten a ticket, a 10-day quarantine in her house. And depending on the breed, and there are some places in the country that are breedist. And if you have one of those breeds that might look like a bully, it's 3 strikes and you're done. Depends
Mm-hmm.
on where you live. You need to know your
Yeah.
local
Ironically, she brought it from this
ordinance.
breeder that she knows someone. Like it's not like a pit bull, not like any. But again, I don't even know what I'm saying. I know there's some dogs that are more aggressive than the other, so I'm sorry if it's not the pit bull. I don't know, but it's not. It's a golden labradoodle mix or something like that.
Oh,
And it was supposed to be small, but it's bigger than it is. And then
huh.
yeah, I honestly I don't know. And yeah, and then now it's got this ear infection, probably for about over six
That's a
months.
food allergy.
She brought it to the vet to give it to the drops, and she can't even put the drops in because the dog's going to bite her hand off. So now every night it's going like this. And I said to my brother-in-law that night, I'm like, why is she doing this? He's like, oh, her ear's itchy because she's got like a yeast infection. And I'm like, And like, what are you doing about it? He's like, well, we can't get the drops in. I keep telling Jen, my sister, we got to bring him back to the vet. She's got to take a pill, like an antibiotic or something. I'm like, oh, this poor dog must be in pain. And my brother-in-law says she's not in pain because she's not making noises. I'm like, really? I'm like,
If no, if she has a true infection, she is in pain, and no
she just
wonder
doesn't
she's a
know how
little
to.
B
She
word.
doesn't know how to express it. I mean,
Right. And so
like
all she's gonna do is bite you because my ear hurts and I don't have any words. Jill, all I'm gonna do is bite you.
I love you, but yeah, okay,
What else am I
wow.
gonna do? I can't say, "Mommy, my ear hurts." I'm gonna say, "Don't
I'm
come
like,
near
I
me."
was about to say, I'm not a doctor. I know nothing. I'm like, I have antibiotics at the house. Maybe I could go get some. I said, and mix it up in her food. Again, I'm not a doctor,
The
whatever.
food that's
But
causing the problem. So today you have shared with me two animals who are having a food reaction.
wow,
Ear infection is the number one sign of a food allergy,
wow, food
especially in
allergy,
dogs. The fat lip in cats is quite common. They also get inflammation on their gums.
gums.
And you
Yeah.
know what the vet solution is to that? We're just going to pull all of their teeth.
Oh yeah, yeah. Oh my goodness.
Because we don't learn in vet school
The
about the
nutritional
quality of the
aspect.
ingredients. Right. So imagine
I
you
commend you,
fed
but
your,
hold on. I'm like, but how do you even
go
have
for it.
time? You as learning to become a vet, you have to learn how many different bodies and systems and
Uh
I'm not
huh.
making
Uh huh.
excuses, but like where's the time for the nutrition? I mean, I could only
We
imagine
learn
the
it
knowledge you
later.
have to learn. So I commend you on this
Oh,
brain that
thank
you have.
you.
But go ahead, go ahead.
Well, we learn it later because you're right. Vet school is not one species like human medical school is. It's like eight species. We get lots of dogs and cats. We have to learn a certain amount of horse, sheep, goat, cows, kind of all goes in the same category, a little bit of pig, and we get a smattering of like
Birds,
chicken and
reptiles.
a smattering. And then there are people who focus and go down that path. And
Okay, okay.
I I did the ostrich class
Did
instead of
you?
the parakeet class.
It's so
Um,
cute.
but you're right because I came out of vet school thinking that those prescription foods were good. I sold them.
Yeah,
And then
yeah.
I had my own dog who was so allergic. And after I learned chiropractic, I went to this seminar about allergies thinking I was going to have, here's some great herbs. And I found out what I was selling to people, what I was feeding to my own dog was causing the problem. So
Oh,
she was my lady dog. My lady dog at 8 years of age. I switched her from the prescription pet food for her food allergies. I switched her to a commercial raw diet that I bought at one of the local stores. And in 3 days, she stopped shedding. Her ear infection that she'd had chronically cleared up, and my really aloof dog became friendly.
wow. I'm showing my sister this show. I've been writing like notes down, but
Right.
I'm like, no, I got to get her a copy. Yeah, she just needs to watch the whole thing. Love you, Jen.
Yeah.
But like, oh my gosh. So
Yeah.
this is a possibility. Poor Ella is suffering. And yeah,
It might be, and so maybe part of why Ella is really grumpy and doing resource guarding is she's afraid someone's accidentally going to touch her ear. Maybe that's why she bit your dad so hard, is nobody even realized it, and they might have touched her ear, and she doesn't have words. All she has is teeth, and she said, "Okay, you touched my ear, I'm going to rip your freaking face off."
but is it possible she could have had an ear infection for over a year now
Yes.
if they don't go away by themselves? So wow.
Right.
Because it started, I'm trying
Right.
to think, she's not one, she's like two, and it started
Okay.
like,
It's
what do you,
possible.
is it going to make her deaf? Like, how do you fix an ear infection in a dog? Okay, if you change the diet,
Well,
but then
right. You
maybe,
need to do some of the Western
yeah.
medicines, and if you have to do some of the antibiotics short term, then you do that so that you get symptom control. And then absolutely change the diet. Of course, the vet's going to recommend their horrible hydrolyzed food,
Well, and she
which
adds,
is the
oh,
same.
besides the Caesar, she does add a little bit of dry kibble too. She showed me a little pouch, and I'm like, and
Oh, perfect.
that's when I was like, Jen, I'm
Right,
like, I've been lectured. I said,
right,
I'm not being mean. I don't know exactly what I'm talking about, but
right,
he does. I'm like, and she told me I'm feeding my cats garbage, and that's where it got
right.
him. Yeah, okay.
And so with your sister, because she and I haven't chatted for weeks and weeks, and I don't know the family, she would be an example of my phone consult, and
Which
I'd
is
have
what
her send.
exactly? Yes.
Okay, right. And so I'd have her send me all the records, and then we'd get on the phone, just like, we'd Zoom or FaceTime or whatever, and we'd go through everything. And I'm like, okay, probably food allergies. Do this with your regular vet to clear up the infection. I want you to change the food to this and this. We figure out what your sister is able and willing to do. And so I help her to get real food going on for the dog and that fits their lifestyle. And then it's a month of follow up, just like you and I texted last week. It's and so that your sister could be like, okay, she just bit my head off. The ear's not going well. Lift up the flap, send me a picture. And so it's a month of follow up so that I can get her some progress. Because that's the problem when you come see us in the office. Hi, here's your 10 minutes. Okay, bye. Take care. See you next time.
Yeah, there, you have
There's no
questions, you have
follow up.
concern, then you call and
Right,
your call doesn't get returned because they have a lot of clients and there's no,
right.
yeah, yeah, I get it. But
Right. And
wow.
so that's my phone consult is that we've got that month of follow up. And then some people are like, gosh, I always want to be able to talk to you. I'm like, okay, move into the monthly membership. And some
Hmm.
people are like, I got it. I know how to do natural now. I'll reach out if I need you. Hallelujah. Yeah. And then they follow me on Facebook. So they get my blog posts and it's healthy possibilities with a paw
Yeah.
.com, and that's how you find me, and that's how I help. And yeah, and we grow babies, we make
You're
healthy
awesome.
babies.
You are just I wish we had longer. I wish we could sound like forever. You guys, you're awesome, awesome, awesome. How many
The
just
sponsors
quickly
will be like, that
no,
costs
no, yeah,
extra.
I know, right? But just quickly, I know we have to go, but like how many people, clients are you speaking to a day? It ranges from like what to what? Like,
Oh my goodness. So when I'm in the office, I have from 20 to 30 appointments. And then all day long, I'm getting messages. I have almost 100 people in the monthly membership.
do you have an
Probably I
assistant to help manage this or you're really good
Oh
at just
no,
time
you're looking at
management?
my
Okay,
secretary.
wow.
And let me tell you about that secretary of mine. That woman, she screws stuff up. So I tell people that and they laugh. And then I'm like, look, if you haven't heard from me in a couple of hours, shoot me another text because sometimes I open your text, somebody walks
Yeah,
in and I
you forget.
fail to unmark it
I do that all the
and
time,
I
but
lose it. So yeah,
well,
I
thank you.
did
I
that.
commend you.
Yeah.
This is amazing work.
Well, thank
Go to
you.
the website, go to Facebook, Healthy Possibilities, sign up, and thank you so much. Great conversation. I
My
won't see you
pleasure.
next week then. Good luck at that.
Two
I want,
weeks.
okay, okay.
I'll let you know
I
about
want,
the meeting.
yes, thank you so much. Talk to you soon, sweetheart. Mwah. Bye.
Bye
Thank
bye.
you.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.